My name's Jessica. I'm going to be your nurse today. What's your name?
My name's Mary.
Nice to meet you. So what brings you in today, Mary?
Well, I'm just kind of concerned right now because I haven't had a period in about 7 weeks or so. And I know I'm a little bit older, but I ended up taking a pregnancy test and it was positive. But at the same time, I'm still like experiencing some vaginal bleeding. So I'm just kind of concerned what's going on.
Okay. Um, is this your first pregnancy or have you been pregnant before?
I've been pregnant before.
Okay. And did you have any complications with those pregnancies at all?
No.
Okay. Um, and are you noticing like any other signs like morning sickness, enlarged breasts? Like if you notice any like changes in your abdomen, anything like that?
No, I think I'm bloated a little bit, but that's it.
Okay. So just the positive pregnancy test then.
Mm-hmm.
Okay, well, we will go ahead and just do another test here just to see.
Okay.
It's been, you said 7 weeks since our last period. So
Yeah.
um, if it is a real positive, then we'll be able to get some results on that. So we'll go ahead and do that. Um, and then we'll kind of go from there.
Okay.
So we get her pregnancy test, and she does have increased levels of HCG. So, Mary, we took your pregnancy test, and you do appear to have increased levels of HCG. So, we're going to go ahead and just do an ultrasound just to see what we can see. And then, again, we'll just go from there step by step. So
Okay.
we set up the ultrasound, and the ultrasound has dense growth with grape-like vesicles in it, and there's no heartbeat, and there's no signs of a fetus. So, Mary, we kind of have some news for you. So we're looking at your ultrasound right now, and it is a little bit kind of hard to make out, but basically what you're seeing on the screen is these little like black dots that kind of look like grapes.
Oh, yeah, I see that.
Yeah, so actually what's happening is, I know it seems like you're pregnant and your pregnancy test came back positive and you did have increased levels of HCG, but actually what's happening is something called gestational trophoblastic disease. And
That
so,
sounds scary.
yeah, so what it is you're not, so I know it seems like you're pregnant, but technically there is actually no baby. What's happening is that you're getting these grape-like, they're called like vesicles, and they're growing inside the uterus, and so it can present the same symptoms as being pregnant, and it will actually like cause your abdomen to like increase in size even.
Oh my
But,
goodness.
yeah, but unfortunately there actually isn't a baby.
Okay.
Yeah, so I know that all sounds really scary, and
Mhm.
I'm not sure what your feelings were, about having the baby, but you know, I know that can be kind of some hard news to hear that there actually
Yeah.
isn't a baby. So just a little bit more kind of about this. Um, it occurs when like fertilization of the egg goes wrong, and then
Mhm.
it just causes those fluid filled sacs to build inside the womb. And so some of the risk factors for this are prior molar pregnancies, which you said that there wasn't any complications with your previous pregnancies. Um,
No.
and then another risk factor is clients who are in their early teens or older than 40, which obviously you fall into because you're 41. So that could be part of it. And so kind of where we go from here is, you're not having any other like negative signs, like your blood pressure is fine. Sometimes this can cause something called preeclampsia, which is high blood pressure.
Oh, I heard about
Yeah,
that.
but your blood pressure looks fine. Um, and that's probably also what's causing your vaginal bleeding.
Mhm.
So basically what we have to do at this point is do this thing called suction cure J, which is when we actually have to go into your uterus and suck those grape-like clusters out, because if we don't do that, the complications um from that can be it's like a malignancy type of growth.
Oh my gosh, does this mean I have cancer?
Not necessarily. It's just something that we're going to keep an eye on. So
Okay.
It's something called choriocarcinoma, and it basically just means that these grape-like clusters are going to keep growing, and then it can just rapidly metastasize and cause more complications. And so we can't leave them in there.
Okay.
And so so that will be sort of the process of that. And then after that, we're going to give you, I don't remember from your previous pregnancies if you remember, like Rogam.
Oh, yeah.
Yeah, so we're gonna give you Rogam, because your previous lab tests indicate that you are Rh negative. And then after that, we'll just be doing some like baseline pelvic exams and some more ultrasounds to just see if there's any more grape-like clusters in there.
Okay.
And then we'll keep doing HCG analysis testing. So we're gonna have to do that weekly for 3 weeks, and then monthly for 6 months up to a year, just to
Okay.
monitor those HCG levels. And that will kind of indicate to us if anything, if there's any more regrowth or maybe we missed something. And then we can go back in and solve that sort of as if those issues arise.
Okay.
So I know that that's a lot of information all at once.
Mhm.
I know that it can be really disappointing thinking that you're pregnant and then unfortunately not being. So, there's support groups that we can set you up with. There's counseling services. We can put you in a psychology consult if you feel like that will be helpful for you. And I will be here for you through this whole process of, the surgery and everything else. And your doctor will come in and explain it all, and you'll sign the informed consent forms and things like that. So we can definitely answer your questions along the way as they come up if you have any.
Okay. Thank you.
Yeah. So do you have any questions at this time? Because I know that was a lot of information all at once.
Mhm. No, but I'll probably have more questions when I get home.
Yeah, that's perfectly fine. And we'll send you with the office number. And that way, if there's any more, complications, if your bleeding suddenly like increases or you're having like sharp abdominal pain or anything like that, you can just call us and then
Mhm.
we'll just kind of troubleshoot it from there and see if we need you to come back in or what we need to do.
Okay.
And then
Sounds
also
good.
just if you have any problems like with your like GI system, like you have like an
Mhm.
upset stomach, like I know you said you were a little bit bloated, but if it kind of like seems like it's more than just like bloating or like your appetite is changing,
Mhm.
you can go ahead and call us too, and then um we might just have to get you in sooner to get that procedure done.
Okay.
Yeah.
All right. Thank you.
You are welcome. I'm really sorry that I don't have better news for you.
It's okay.
Yeah. Okay, well, yeah, if you have any questions, you just let us know, okay?
Okay. Thanks. I will.